Good evening. I'm Brian Turner. I've worn several hats since I sat down here this evening. The hat I'm wearing now is a member of the Carleton Place Municipal Drug Strategy Committee. We're a group that's been in existence over 10 years. We're an advisory committee to Town Council, and as such, we have an elected councillor who sits on our committee. And we've been working quite closely with Planet Youth Lanark County since their inception. It was natural. And what I'm here to talk about tonight is briefly putting boots to the ground locally. We need to look at engaging more public in more meaningful discussions about the results that we've seen of the survey. We need to look at what programs and actions we think we can physically take place and do in Carleton Place. So I'm trying to speak of a local flavor. But when I thought about that at our last Municipal Drug Strategy Committee meeting, if you look at a map of Carleton Place, it's quite delineated and quite small geographically. If you ask the people that live around here where they live and draw that map by the number of people that say, I live in Carleton Place, we become a much larger community. We move out into the townships, and that's a natural thing. And especially with youth that associate their place of residence as where they go to school. I go to school in Carleton Place, I'm from Carleton Place. So we need to have those discussions about what can work here locally. And when I sat down and looked at the survey for the first time when it came out, it was kind of daunting, but it didn't take long and too many read-throughs, I'm a little slow, to know that a lot of the answers were there, where we see the lack of supportive factors and the connection between good supportive factors and low risk. And then we've heard from Rebecca with a lot of great ideas from the youth perspective. We need to be able to look for community champions to not rewrite the book, not reinvent the wheel, to support a lot of the good organizations that are in our community that have been doing great work for years. Some quietly, some underfunded, some under-resourced, but have been doing great work. Our youth centers, our parks and recreation departments, our schools. And I've been impressed from the outset the amount of resources that we've had behind us at Planet Youth Lanark County. We might seem like a small group when we sit around the table, but we have the resources of professional researchers, the resources of the public health department and the school boards, and they bring a lot of resources to the table. So what my call is tonight is to try to find, we have done this at our last Municipal Drug Strategy Committee. We passed a motion to become a community champion for the Planet Youth model and to take the next steps and help people along. We can't do this by ourselves. It didn't take a small handful of people to get us into the situation we're in today. It's going to take a lot of people to help get us out of that situation and move towards public health. So when I look to advance my last slide, so I can shorten this. We need people at the table. Our table is open, and I'll make a shameless pitch for the Municipal Town Hall that they take our applications for our committee, the Municipal Drug Strategy Committee. If you're interested, the deadline for the upcoming term is tomorrow. Sorry to leave it at the last minute, folks, but people can apply at any time, and we do need voices, we do need experience, because we have to be able to take these next steps to move things along, because we're under a bit of a time crunch. There's a very large group, a large audience watching what we're doing with very focused eyes, and those are the students that completed those surveys. We need to be able to show that they place their trust in the right people, that we can help move things along to improve things. So I urge anyone who's interested in joining us at the table and helping us take these actions to contact Town Hall through the clerk's office, and it's quite easy to do. And then our meetings are very short. We run them fairly efficiently. Either we try to do it live when we can, but we've done it on hybrid models, and we've done online-only models when we had to. And they're only about an hour a month. We're not asking for a lot of time from a small group of people. We're asking for small amounts of manageable time from a large group of people, and I think we can achieve that. That was my pitch, my shameless pitch to join the exciting world of volunteering, trying to reduce problematic substance abuse among youth. Thank you very much.
I think I'm the last